We're going to talk about toothache. It's a really widespread condition. Everybody's familiar with toothache. And the biggest thing that we have to talk about today is the impulsive self-medication that people indulge in when they have a toothache. They head for their medicine cupboard and drag out all kinds of things like antibiotics, anti-inflammatories, analgesics, and sadly occasionally leftover opioids from the back of the cupboard. So there's many side effects that come from this practice, and it also pushes more antimicrobial resistance. In contrast, we all know that homeopathic medicine doesn't have those side effects. People get addicted to the gorgeousness of homeopathy, but they don't get addicted to the substance of homeopathy. So to start off, I have to tell you a story, a true story of somebody called Anita. And it's just imagine it's a stormy, stormy night, it's midnight, and Anita's got the most excruciating toothache she's ever had in her whole life. Maybe it started just a couple of days ago with a little tingle or a little problem with drinking cold drinks. And now it's midnight and it's screaming in her head, and she's running around holding her head, pacing up and down because the pain's so extreme. She's already taken a couple of Panadol that afternoon. So she heads to the medicine cupboard and she opens it up and she grabs some more paracetamol. And then it's still not really helping because the pain is getting more severe and pounding away in the head. So she goes back to the cupboard, and this time she thinks she's remembering, maybe you're supposed to alternate paracetamol with Nurofen or one of the anti-inflammatories. So she grabs some of that from her cupboard as well. And maybe 10 more minutes have gone by and still no relief. So what does she do? She goes back to the cupboard and she sees leftover antibiotics from her cooked barley. And she takes that as well. And still no relief from the pain. So then she's seeing the tramadol left in the back of the cupboard from her husband had the knee surgery done. So I don't know what you do in Malaysia if you have extra opioids given to you for pain relief and you don't use them all. You put them in the cupboard just in case one day you're going to need them. So she takes the opioid as well. So this is all in the space of like 45 minutes. Sadly, this is a true story, and sadly some of these people end up in a lot of trouble. So somebody decided they really need to do a little bit of work about this. They did a systematic review with a big analysis, and they looked at self-medication of a dental origin around the world. They did a global systematic review. There's many, many studies that they looked at. I think 28 altogether they included. They found globally 72% overall prevalence of self-medication, including the misuse, overuse, and irrational use of medications. And that's the medications I just mentioned, paracetamol predominantly, and then anti-inflammatories as well. And we all know the side effects of anti-inflammatories, taking too many of them, you ruin your gut lining amongst other problems. Opioids and antibiotics. And this is happening, this is a global problem. So the biggest question from that analysis was about why do people self-medicate? Everybody self-medicates. You have a headache, you have a toothache, everybody goes to their cupboard and pulls out the best thing that they can find to deal with it. Maybe if they think the toothache is persistent, maybe they'll try and make a dental appointment. And I'd like to point out that in Australia it's not easy to get a dental appointment. It costs a huge amount of money. And I just learned recently that in Malaysia you can pay RM1 and go to the dentist. It's crazy, unbelievable. Basically people are seeking temporary relief, hoping it to be a minor problem. Obviously some people are postponing trying to make a dental appointment because they're afraid. They don't like going to the dentist. They have huge anxiety. They have anxiety for socioeconomic reasons too, because it's going to cost a lot of money. They might have to take time off work. Obviously, if they have previous experience of taking paracetamol and pain, of course they're going to do that again. I just mentioned about difficulties accessing dental care in Australia and other countries. one of the big things is about the lack of knowledge about adverse effects. This is a very big problem. The general public are not that aware of the upper limits of how much paracetamol and other medications you can take in one space of 24 hours. They are not aware of the side effects of these medications. And one of the big things in pharmaceutical advertising is about paracetamol. Yes, you can take it, no problems. So it's a big thing about the lack of knowledge about adverse effects. And I will go back to the story about the lady pacing up and down, Anita, who's a very well-educated person who knows about the upper limits of paracetamol taking and would do that anyway in the middle of the night. And there's a good reason for that. This is about desperation. This is about the pain is overriding every bit of knowledge that somebody has about side effects of pharmaceuticals. In Belgium, they did a similar thing by looking at the people who were attending a dental emergency service. And the biggest reason that people were coming there after having misused medication was, again, it was desperation to try to fix the pain. Around half of the people had used 2 different analgesics in combination. 62% of people exceeded the maximum daily limit. I think we just need to repeat that. 62% of people took more than what they should have through desperation. Opioids of tramadol and codeine were more widely used than in other surveys. Using leftover products was common. I think in Australia, people are encouraged to take back their opioids after surgery, return them to the pharmacy. That's the party line that everybody should do, but nobody does. They keep it there because one day they might need it. One day they might need that. So that really makes you think about paracetamol overdose, doesn't it? Because if more than 60% of people in the dental emergency department in Belgium were overdoing the daily limits, how often do people actually have an overdose problem? So this is another study in the British Dental Journal. 38% of people are taking a paracetamol overdose. People coming through emergency services, most of those people who were having an actual overdose of Panadol it's inadvertent. They hadn't meant to do it. They'd done it through desperation. They might be in the upper socioeconomic groups and highly educated, but they had exceeded the daily doses through desperation. So we know there's many clinical case studies written up about toothache and homeopathy. Turns out that homeopathy is the pants for toothache, I tell you what. So there's quite a number of studies done, one of them in a dental surgery in the UK with 14 dentists. They wrote about treating toothache, obviously all the remedies that we know, Hepsol, Anika, all different kinds of remedies. And another one in India, with similar kind of findings that homeopathy was highly effective for toothache amongst all the other things that cause pain like abscess. So I'll just tell you briefly a couple of little case histories, or maybe just one of them because time's running out. There's a man who is 49 years old, was experiencing excruciating pain, keeping him awake. He'd gone through a period of high stress at work, and the pain had all of a sudden hit him very hard. He was very, very anxious. He was also pacing the floor. The pain was so severe, pacing up and down. So we gave him arsenicum 10M, and it had quite a dramatic effect with the anxiety almost disappearing. And the toothache was relatively unaffected by the arsenicum, but it was a very good start in his treatment because arsenicum, we know, treats a wide variety of things. So maybe a day later, after the arsenicum had helped with anxiety, he approaches again to say, what else can he do? So another repertorization came up, this time with Plantago, which also has this habit of pacing when they're in pain. think it's one of the few remedies in the repertory that does that kind of particular behaviour when they're in pain. So Plantago in a 6C this time was given because we don't have 10M in the clinic. So 6C was put into some water and he was sipping on that pain and also sipping on the pain. He was sipping on the water with a great effect because the Plantago, as we all know as homeopathy, it's an amazing remedy for ear and dental pain. It also has anxiety, but not as extreme as the arsenicum. So that's just an example of a time when homeopathy is very effective for toothache. And I'm going to finish now. Thank you, everybody.